Good morning, everyone, and welcome. I've been asked here today to speak with you briefly on the topic of professional communication. Because professional communication is a very broad topic, we are necessarily going to narrow this down a bit in our 30 minutes together to discuss specifically some practical ways to improve your professional communication skills as a means of improving your job satisfaction and your workplace relationships. I've met some of you prior to today from our perhaps many years together here at the VA hospital. However, for those of you who do not know me, I am Tom Rutledge, a staff psychologist with the VA San Diego healthcare system for more than a decade now, and I'm also a professor of psychiatry next door at UC San Diego. My specific area of practice is what is known as health psychology, and as a result, I spend much of my time working with veterans, both individually and sometimes in groups, discussing ways to make improvements in areas such as chronic health conditions, relationships, and their quality of life. Several years ago, working as I do with our pain management services, I began speaking more with my fellow healthcare providers about particularly thorny topics such as opioids, and specifically say how to have better conversations as providers with patients around opioid use. Although opioid discussions are, of course, a great example of a difficult communication topic, it turns out that healthcare providers, like yourselves, face communication challenges all day long and in many forms. For this reason, in the last couple of years, I've been asked to speak more frequently on more general communication topics that can perhaps help each of us be happier and more successful in our roles as healthcare providers. Before I jump into my content, let me state the obvious. Statistically, you are already an excellent communicator. As a healthcare provider, you are necessarily smart, experienced, and well-educated. Your hospital roles further require a large amount of communication, meaning that you are also well-practiced. On the surface, healthcare providers would seem to be among the least likely groups to need a class on communication skills. But here's the reality. Because of your smarts, combined with your helpful nature as a person, you have self-selected yourself into a profession that involves managing the health and well-being of the most complex machine in the universe, the human body. Such a daunting task strains even the most skillful and dedicated professionals, and this is why, despite your extensive training and skills, you can still easily find yourself struggling as a healthcare provider in the 21st century. As healthcare providers in general, and as VA healthcare providers in particular, we face many obstacles to job satisfaction. I began my career just as the computerized medical record system era was beginning, back at the turn of the 21st century. At that time, it seemed like the dawning of a new and better era. I was already experienced with the pre-computerized medical record era, where it was often a challenge simply to read a physician's handwritten note, or sometimes to even find a patient's chart. But the computer era has not been the savior that we expected. In fact, in recent surveys of healthcare providers, the computerized medical record is commonly listed as among the single biggest detractors to job satisfaction and to patient care itself. One of the reasons for this, I believe, is that with computers came metrics. Metrics are attempts to quantify the complex art of healthcare into measurable standards to permit tracking and improvement. The bureaucratic motto is that if it can't be measured, then it can't be managed. Unfortunately, the result of this motto is a few metrics that are in fact very good measures of healthcare practices, and unfortunately many metrics that are very poor measures of healthcare practices, but that we as providers are nevertheless expected to prioritize, sometimes above actual patient care. Thirdly, as VA employees in particular, we are all too aware of the negative narrative about the VA propagated in the media. No matter how hard we work or what good we do, negative news about the VA seemingly always outnumbers the good news. In short, although of course our individual circumstances vary in our different roles here in the hospital, we are each besieged by many sources of adversity that jeopardize our ability to thrive as healthcare providers. The consequences of the hospital hazards we face as healthcare providers are many, and one that has come into the spotlight in recent years is what is called professional burnout. In this and the next two slides, I will share some recent data about burnout and depression among physicians. Keep in mind as I do so, however, that these same trends are present across other healthcare professions as well as we review these statistics. A simple interpretation of this graph is that young doctors begin their careers relatively optimistic and perhaps a little naive, with the goal of becoming one of those rare doctors that really makes a difference. Then reality sets in. The harsh and often unforgiving demands of healthcare work take their toll, and many of these idealistic doctors have their hearts broken and their souls crushed by the time they reach middle age. Many abandon the field during these years, leaving behind those doctors that were either lucky enough to survive unscathed or too busy counting down the days to retirement to give up. Unfortunately, burnout is only one of the modern threats to job satisfaction among physicians. All too often, the data suggests that doctors are also experiencing symptoms of clinical depression. Perhaps most concerning, as you can see here on the left, is that depression is highest among the youngest doctors, raising worries about what will happen to these young doctors as they move further into their careers. Suicide, shown here on the right, is one of the dark secrets of the medical profession. We are speaking here today as fellow VA providers, and as such, we are all too aware of the high rates of suicide among veterans and of the national efforts to help reduce suicide risk among our veteran patients. Yet you probably never hear the bleak but true statistic that the doctor treating the veteran is statistically at even higher risk of suicide. As grim as this is, as healthcare providers, we can't expect our mental health to become a government priority. We are considered educated and skillful providers that possess the resources to manage our own problems in these areas. In considering these statistics I've just shown you on burnout, depression, and suicide, what do you think healthcare providers identify as the chief contributor to these problems? Sure enough, for most healthcare professionals, the primary source they report for their depression is their work. This isn't to say that financial, family, and health factors also can't or don't also play a role, but that the largest source typically comes from the workplace. Rather than empowering them with a sense of contribution and growth, healthcare work all too often leaves providers feeling burnt out and depressed. Clearly this has to change, but how? The typical response to this crisis in healthcare job satisfaction is to blame the system and the people in the system that seem to create all the obstacles. Yet, as intuitive as it may feel to blame our hospital surroundings, this is an unlikely path to improvement. Realistically, the hospital environment and the behaviors of our patients and colleagues in the future are likely to remain about the same. In fact, the demands of the hospital environment are more likely to grow rather than to become easier as computers and metrics and healthcare standards become ever more present and complex in our work. But if the hospital system isn't going to change and human nature isn't going to change, what is there to do? What I am encouraging you to consider today is a change in your professional philosophy. Your job satisfaction and workplace relationships will improve in direct proportion to your investment in professional development. As we develop new skills and better philosophies, the workplace problems that we face become easier to solve, and our patients and colleagues respond to us in new and better ways. Most healthcare providers want the job to become easier, or for their problems to diminish or disappear on their own, whereas I am suggesting the opposite, that the better path for us is to become stronger and wiser and more skillful than the obstacles that we face in the workplace. If this approach seems counterintuitive, consider how absurd it would be for an Olympic athlete to go for the gold in their respective sport by simply hoping that their competition somehow gets worse. The Olympian knows better. They know that gold medals are won by athletes that dedicate themselves to becoming better than the competition, and as healthcare providers, we can prosper by adopting the same philosophy. The business philosopher Jim Rohn is one of my favorite professional development experts, and he uses this analogy to discuss the role of professional development in the workplace. It is the set of the sails, not the direction of the wind, that determines which way we will go. In Jim Rohn's analogy, the winds are the important parts of our workplace, such as the behavior of other people or the rules of the organization, that are mostly out of our control. Any experienced sailor knows that you cannot depend on the winds or the weather to get to your desired destination. What the sailor can depend on is their ability to sail, and this refers to our professional skills. For our skills are what set our own personal, professional sails in the direction of either success or failure, happiness or misery. Enhancing your communication and your other professional skills is what can bring you the greatest satisfaction and success in the workplace. In discussing the role of communication skills in the hospital, let me be clear that we are discussing three types or domains of communication. There is your ability to communicate with your patients, your ability to communicate with your colleagues, and of course your ability to communicate with yourself. Even among healthcare providers such as yourselves, professionals with well above average communication skills, my experience suggests that you probably excel in one or even two of these communication types, but perhaps struggle in another. The two examples that I've seen most often are these. First, many healthcare providers are excellent communicators with their patients and even their colleagues, but poor communicators with themselves. They are, for example, caring, compassionate, and supportive with others, but critical, unforgiving, and neglectful of themselves. This, as you can imagine, is a recipe for burnout and job dissatisfaction, even in an otherwise very skillful provider. The second example is the healthcare provider that perhaps communicates very well with colleagues in their own area of specialty, such as those who have similar training and perhaps speak a similar vocabulary, but struggle with patients or with colleagues outside of their discipline. If you consider these three communication domains as being similar to links in a chain, then it becomes apparent that the links work in unison, and that therefore any single weak link is enough to limit your ability to thrive as a healthcare provider. The personal question I raise to you is, which of these three domains is your own weak link? Here are what I call the 7 deadly sins of communication in healthcare settings. Complaining, criticizing, focusing excessively on problems, infecting our workplace discussions with politics, interrupting and arguing, and finally, gossiping. If you and I had the power to become invisible and secretly track communication patterns in clinics across the hospital, we would observe that these deadly sins are committed many times per day, and by providers across all disciplines and levels of experience. Another way of thinking about these sins is to consider them as types of social diseases, for the reason that they are highly contagious. Even if you don't initiate these sins yourself, you can easily pick them up from others and then pass them along, in much the same way that a flu virus spreads from person to person. It has been said that if you spend 5 minutes complaining, that you have wasted 5 minutes. But personally, I think it is much worse than that. Complaining, as well as the other sins listed here, put us in negative emotional states that can easily last much longer than 5 minutes. Practicing a few of these sins can ruin your whole day, and a regular pattern of them can lay waste to your hospital relationships and harm even your career. Which of these sins do you most frequently practice? In the lower left, I have an image of Ben Franklin's autobiography. I include this picture because Ben is an inspirational person from our history who had the wisdom to see that his road to professional success required that he improve his own character and communication skills. Ben recognized, for example, that he was held back by his tendencies to argue, criticize, and interrupt, preventing him from becoming the person of influence that he desired. By taking an uncomfortable but necessary look in the mirror, Ben identified 13 areas in need of personal improvement. Now, 13 is a lot, and more time than I have with you here today, but I believe that we can productively begin by examining ourselves in relation to just these 7. Progress in the area of communication requires that we both eliminate the communication habits that are holding us back and develop the communication habits that can move us forward. As we work to eliminate the communication sins, we want to replace them with communication virtues. Ben Franklin referred to his personal development goals as his 13 virtues, dedicating at least a month to just 1 or 2 virtues at a time in order to give them the level of attention necessary to make meaningful improvements. The 7 communication virtues I list here originate from many classic sources, some dating all the way back to the Bible. Famous authors such as Andrew Carnegie and Napoleon Hill, for example, discuss the virtues of collaboration, listening, and complimenting. Stephen Covey, author of the bestseller The 7 Habits of Highly Successful People, discussed the concept of sharpening the saw. Sharpening the saw refers to maintaining and developing ourselves. Consider burnout among healthcare providers as a kind of professional rust that sets in from neglect and overuse, in the same way that the sword of a medieval knight could rust and decay from a combination of too much use and too little care. You, as a healthcare professional, also require regular sharpening to prevent burnout, and this means a career-long commitment to your own professional development. Ray Dalio is a highly successful investor who recently authored a book titled Principles. This book is filled with professional wisdom and emphasizes many points about communication in the workplace. One of the many concepts he introduces is the one shown here as thoughtful disagreements. Thoughtful disagreements are the opposite of arguing. In an argument, the goal of the discussants is to win or to prove your point to the other party. In a thoughtful disagreement, on the other hand, the goal is to achieve a mutual understanding and to arrive at a course of action, not for one party to be right or to win the discussion. In a hospital like ours, filled with smart, creative professionals, there will always be disagreements. If our method of resolving disagreements is to argue, then we will be arguing often and contributing to a negative work environment. Instead, if our method of resolving disagreements is to engage in thoughtful disagreements, then we can make decisions while expanding our perspectives on the complicated issues that we face in the hospital and improving our relationships with colleagues. Here is the challenge that I offer you regarding these communication sins and virtues. Dedicate yourself for 1 week to trialing for yourself how much benefit these changes can bring you. Some of you may be skeptical about these benefits for a variety of reasons. Some may think, for example, that they are already doing a good enough job and that doing even more won't make much of a difference. Others may think that it is their colleagues and patients that need to change rather than themselves. If you happen to fall in either of these categories of skeptics, I ask you, what do you have to lose by trying and seeing for yourself? Probably all of us can relate to the concept of following a diet too high in junk food and too low in quality food. I am here making the analogy between a junk food diet and a junk communication diet. A junk food diet can ruin your health, whereas a junk communication diet can ruin your career and your relationships. In the same way that we can improve our food diets by reducing the low-quality sources and increasing the high-quality sources, we can improve our communication using the same philosophy. Embracing the path of professional development means adopting practices that support continuous learning. You and I are fortunate enough to live in the golden age of learning, surrounded by resources to help us master virtually any skill that we desire. As mentioned, there are many classic sources of learning behind the materials that I presented today, and here is a small selection of some of the books that I recommend. Several years ago, I heard a story that Bill Gates, the founder of Microsoft, was once asked if he could have any superpower, what would it be? If the story is correct, then Mr. Gates responded that he'd like the superpower ability to read books faster. It turns out that this philosophy about the importance of reading is very common among highly successful people. Fortunately for us, you don't even have to read fast. You just have to read consistently. You can read War and Peace 3 times this year, for example, cover to cover, by reading just 10 pages a day. So you don't even have to read a lot at a time. And for those of you that prefer to learn through watching or listening, I can also provide many great videos on similar subjects. Another interesting book I read this year is titled Tribe. The author of Tribe makes the argument that we evolved as humans to coexist in small to medium-sized tribes wherein every member was valued and there was a strong shared identity that promoted the success and survival of the tribe. Historically, a dysfunctional tribe that could not coexist effectively or could not come together during times of adversity did not long survive. The next tribe down the river, for example, would take advantage of their weakness and wipe them out. Today, however, if you consider the hospital clinics that we work in as a type of modern tribe, then unfortunately, highly dysfunctional tribes seem to be common, and they have the ability to now survive for many years, even while creating misery among their tribe members and probably providing poor care for their patients. One book from the previous slide described the modern communication practices of the respected Cleveland Clinic. Although we are all familiar with the modern goal of practicing patient-centered care, the Cleveland Clinic advocates going even further as healthcare professionals to becoming relationship-centered providers. This means treating our relationships with patients and colleagues as the most important part of our work, and developing the communication skills and habits to help our workplace relationships thrive. It would be a mistake for me to overlook the most common obstacles that you may have in regards to adopting these ideas into your professional routines. As a health psychologist, one of the lessons that I learned early and often in my career is that most people will keep doing what they are doing, no matter how harmful it is, until they have their own personal epiphany. The great physicist Isaac Newton probably expressed this concept better than anyone in his first law of motion, reading that an object at rest will tend to stay at rest unless acted upon by an external force. Even though Newton was referring to inanimate objects rather than people, the law also applies to us, with perhaps one caveat. Give your most passionate and eloquent appeal to a dozen smokers, for example, and on average 10 or 11 of them will find a reason to continue smoking. On the other hand, I believe that we can all appreciate that anyone has the potential to start making changes for the better. It is really up to each of us as individuals to decide when we are ready to begin, because unlike that rock that lives strictly in accordance with Newton's laws, you and I also have the power to change course as a result of an internal force. As a final analogy, consider the process of professional development that we have discussed today as something that is similar to the process of starting a fire. Even if you have the fuel for a fire, for example, you still need a spark. And even if you have a spark, it may or may not catch depending upon the circumstances. I compare this class today to a kind of spark intended to light your own professional development fires. If this class has been sufficient to inspire you and you're willing to invest the time and effort, your job satisfaction and professional relationships can be in a much better place this time next year than they are today. In closing, here are 3 reminders about the themes that we have covered today. First, it is useful to consider yourself as a healthcare professional as being similar to a piece of clay. Like a piece of clay, your professional skills and character are moldable into just about any form that you can imagine. Aristotle observed this truth long ago in his famous quotation shown here. If you wish to be a happy and successful healthcare provider, you must practice habits that promote happiness and success. If you wish to become a great professional communicator, you must similarly practice great communication habits. One of the critical lessons from today is to abandon the common but unproductive habit of blaming our colleagues and our professional surroundings for our job satisfaction. If your work environment is truly toxic, then you are probably better off finding a new workplace in which to practice your skills rather than trying to change the one that you're in. But keep in mind, all hospital environments are difficult by the very nature of the problems and the responsibilities that we face. Instead of criticizing the workplace and the people that probably won't change, we will usually obtain much better results from directing our energies towards ourselves to develop these skills and philosophies and practices that can increase our success. If professional development is the most profitable path to job prosperity, then it is critical that you take away the challenge from today to adopt a career-long commitment to excellence. This means a commitment to reading the books, attending the classes, watching or listening to the videos and podcasts, and practicing the skills that can keep you progressing from year to year and enjoying the intrinsic rewards of personal growth and effective helping that probably inspired you to become a healthcare professional in the first place. Finally, because I have covered a number of complicated ideas with you here today in a very short period of time, I leave you with my contact information for those who would like more information or resources related to these topics. Thank you.